Hello everyone, I am Dr. Aparna, Senior Consultant, Neonatologist and Pediatrician from Cuddles Hospital. This is monsoon season and one of the important infections that we see among kids is dengue in this part of the year. Now it's important for us to identify what are the typical signs and symptoms of dengue infection. Dengue, as you all know, is a viral infection that is spread by the bite of a mosquito named Aedes mosquito, which is known to breed in clean water that collects in various places. Now, if a child develops fever, again fever can be either low grade or high grade fever, and if this is associated with some typical symptoms such as these, you may suspect whether this could be dengue fever. These symptoms include the presence of skin rash over the body. This can be mild reddish rash over the entire body. There may be associated tiredness, excessive lethargy, excessive dullness. The child may complain of severe abdominal pain and vomiting, particularly in the upper abdomen. There may be pain involving the head or the area around the eyes. So, severe body pains, pain, headache or periorbital or pain around the eyes may also be a sign of dengue. And if the child complains of excessive aches, decrease in activity and decrease in intake, this must raise a suspicion whether the child needs hospitalization and extended care for dengue. So when it comes to the investigations, the typical abnormalities that we see are a drop in the white blood cell count and platelet count, and in severe cases of dengue where there may be lot of fluid loss, the child develops increased hemoglobin concentration called as hemoconcentration. The suspicion of dengue is further confirmed by specific tests such as NS1 test or dengue specific IgM or antibody based tests. We need to remember that dengue infection occurs over 3 phases. The first phase is the febrile phase, second phase being the critical phase and third phase being the recovery phase. So fever with the associated signs and symptoms may usually come up in the first 3 to 4 days of the illness. And once the fever comes down, the critical phase may begin wherein there may be a fall in the counts, and this is the phase when we have to be very watchful for low blood pressure and other signs because of excessive fluid loss from within the blood vessels. This is followed by the recovery phase, which is accompanied by normalization of the cell counts as well as the symptoms. So very important to watch for the complications when the fever actually comes down. So we may often ask the families to come back for a review of the white cell count, platelet count and hemoglobin when the fever actually begins to settle over the next maybe 3 to 4 days until the counts begin to stabilize. So please don't panic. Dengue is very much a manageable infection when the signs and symptoms are identified early and appropriate medical attention is sought. Thank you.